Hi guys, this is Mrs. Hallman, and today we're going to be reviewing part 2 of our cardiovascular system lecture. Today we're really going to be covering the blood vessels that feed and take deoxygenated blood away from the heart. The previous lecture was about the anatomy of the heart and the flow of blood through it. Part 3 is going to cover the blood and how that tissue is made up, different parts of it, and how it flows through the body. So let's get started. So we talked before about the different arteries and veins that take blood to and from the heart, but there are specific arteries and veins that will be designed just for supplying the heart tissue, the cardiac tissue itself with oxygen or to remove deoxygenated blood. So these arteries and veins you can actually see on the surface of the heart. Again, we're following that same color pattern that the deoxygenated blood is blue and the oxygenated blood is red. So you can see that we have a right and a left coronary artery, and these are the arteries that will actually supply that cardiac tissue with oxygen itself so that it can beat. Now, the veins that will return deoxygenated blood, those will collect the blood. They're called the great cardiac veins or the coronary veins. And these veins will return it through this thing called the coronary sinus, and that will return it directly into the vena cava or the right atrium so that it can be circulated into the lungs, just like the rest of the deoxygenated blood. So one of the conditions that's involved with, or that involves these coronary arteries specifically, is a condition called atherosclerosis. And this is essentially when you have a diet that is very high in saturated fat. There are also some genetic ties to atherosclerosis. And essentially what happens is that those saturated fat molecules will start to attach to each other. Remember from bio class that lipids are hydrophobic and that our blood has a lot of water in it, which means that any fats in our blood like to stick together, and that's what forms these plaques on the inside part of our arteries. Unfortunately, these plaques over time will harden, and what that means is that the artery not only will experience less blood flow, because you can see in that cross section that this artery here would be semi-blocked by that plaque, but it also causes the arteries to be somewhat rigid and brittle. And that means that it's more likely that that plaque would break off and it would cause a clot somewhere else, which is really not a good thing. The other thing that is involved is if that clot would break off and it would clot one of the coronary arteries in the heart, we would call that a heart attack. If that clot would travel through our arteries to the brain, that's what happens when we have a stroke. So atherosclerosis is something that is definitely something that is not a good thing for our body, and you want to make sure that between diet and exercise and healthy life choices that you can prevent that. One other condition that is involved with those coronary arteries is a heart attack. So another name for a heart attack is a myocardial infarction. And this essentially is, like we just said, when one of those coronary arteries gets blocked. And the actual heart attack is because the cells of the heart, so those cardiac tissue cells, would no longer have sufficient blood flow. Therefore, they would not have enough oxygen to go through normal cell respiration, and those cells would actually start to die off. So in a massive heart attack, that's when the blockage usually happens to a giant section of the heart. And if it's severe, it will actually damage that tissue so that it can't be repaired. So that's when a really, really bad heart attack is when large sections of that cardiac tissue would die off and can't be repaired. And you can see some of the common warning signs of a heart attack. A lot of pain and discomfort, the feeling of like an elephant sitting on your chest. A lot of times there's pain in the left arm, difficulty breathing, some lightheadedness, and some nausea. Okay, now this is something that we're kind of reviewing. We talked about the difference between arteries and veins. What I wanted to go over was a way to kind of differentiate between the different sizes of the arteries and the veins. So we can see in this part that there's a common flow between arteries and veins. So if we start over here on the artery side, okay, this is going to be oxygenated blood, and the largest diameter of vessel that we have would be an artery. When those arteries split and become smaller and smaller, we call them arterioles, okay? So arterioles would be the smaller diameter ones, and those would feed directly into what we call capillary networks or capillary beds. So it would be at this point where we would be able to diffuse out of these arterioles in the capillary bed. We'd diffuse out the oxygen, and it would pick up CO2 from the surrounding body tissue. That CO2 would then go through the vein part of the capillary bed through what we call a venule. So that would be the smaller diameter of vessel of the vein system, and then in through the vein, right? And this would be blood that is carrying CO2, and this would return back to the heart, all right? It typically would attach back to the vena cava. Okay, so if we follow that whole sequence, we can see that blood is going to come from the heart, going to be pumped through the arteries, branching into arterioles, which branch back into capillaries or capillary beds. Those are then going to dump off CO2. They are going to pick up CO2. I'm sorry, they're going to dump off O2. They're going to pick up CO2. They'll form back into venules and then go back into veins, go back into the vena cava, and then eventually end up back into the heart. Okay, so that's kind of the sequence from beginning to end for all of the vessels of the heart. Okay, so let's talk a little bit more about that capillary bed network. So those capillaries have the ability to actually affect homeostasis. And how do they do that? Well, in those capillary beds, they have the ability to actually move blood to or from those capillary beds. And the way that they do that is through these smooth muscle sphincters. All right, so here again, we have our main artery breaking into arteriole and then going into our capillary bed. Now, one thing you need to realize is that because this bed is going to increase the surface area and it's going to spread that blood out over a large area, and a lot of times that this large area is going to come closer to the contact of the skin, so it's going to be in our body tissue. There's a lot of heat loss that can happen in capillary beds. A lot of times that's a really good thing. That's how we are able to cool off if you're exercising and you get flush in your face. That's because your body is releasing a lot of heat through those capillary beds, through moving blood closer to the surface of the skin. However, if the opposite happens, let's say that you're really, really cold, we want to try to preserve as much heat as we can, which means moving blood through those capillary beds is going to increase heat loss, and that's not what we'd want to do. So on the arterial side of all capillary beds, there are these smooth muscle shunts. And basically what happens is these little shunts, these sphincters, will contract, and that's going to essentially stop blood from flowing into the capillary beds. So essentially it's going to shunt blood away from the capillary beds and just return it directly into the veins. And this is a mechanism that would allow us to go through and conserve a lot of the heat that we might lose by moving the blood through the capillary beds. Okay, so I wanted to look and kind of explain in more detail of the different anatomy, the different structure between a vein and an artery. So remember, veins are anything that are going to be taking deoxygenated blood back to the heart, all right, pumping it into the lungs where another gas exchange would occur, and it would pick up oxygen, returning it back to the other side of the heart and around the body. So if you think about the two different structures of an artery and a vein, one of them is going to be under much higher pressure. And the answer to that, which one is under much higher pressure, is the artery. And the reason for that is that this left ventricle is one of the strongest muscles that we have, and it's going to have enough force to pump all of the blood from this left side of the heart the whole way through the rest of our body. So this is where the pressure in our blood vessels is going to be the highest. After pressure goes through capillary beds, it is extremely low. And in fact, veins, the blood pressure in veins is very, very close to zero. So we have high pressure needed for arteries and we have low pressure in veins. All right, so let's look at how that reflects in the structure. Remember, structure and function are really closely related in anatomy. So if we look at the close-up of an artery, the first thing I notice is that the actual thickness of the wall of an artery is much thicker than that of a vein. And that makes a lot of sense because if this is under a higher pressure, that means every time the heart beats, it's going to be putting pressure on the inside of the artery, pushing outward. And that's why we need a thicker wall, okay? Now the veins, we have a different problem. Like I said, the pressure on this side of our circulatory system is very low. So what that means is that a lot of times, especially since we're bipedal and we're standing upright, that blood is going to have to move against gravity at a very low pressure. And what is likely to happen because of those two circumstances is if blood is moving in this direction, if it has low pressure and it's moving against the gravitational force, it might have a tendency to kind of collect in the lower extremities of the body. So what we can see, the anatomy of the vein helps with that function. So inside of the vein, we have these one-way valves. And essentially when blood moves through, it's going to open up. But as soon as the blood moves through, this is going to close again, right? And what that allows is that the backflow of blood won't, it prevents against the backflow of blood. That way, blood will not kind of accumulate in our lower extremities. Now, over time, and especially if you work in an environment where you stand on concrete or you have a really rough job and you don't wear supportive shoes, that can put a lot of pressure on the veins in your lower extremities. So over time, if those valves start to stretch, if they start to become overworked, they can become a little leaky. And what that does is it actually stretches out and bends the structure of the veins. And because those valves are no longer stopping the backflow of blood, it can start to pool between the valves and start to actually bend the veins where more blood would accumulate in those areas. And we call that varicose veins. All right, so varicose veins would happen typically in the lower extremities. Again, they're aggravated by standing on really hard surfaces with unsupported shoes, typically later in life. So we've talked about this in the other diagram, but this is a really good a refresher and a way to look at it, that in this artery, the outside covering of the artery is going to be very similar to the vein, but the inside covering is going to be made up of thick muscles and elastic fibers. And what that means is that the artery would actually be able to stretch. And when you dissect hearts, you can actually feel the difference between the arteries and the veins. The arteries are much thicker and they're much more substantial. The vein, on the other hand, while it's still surrounded by the same type of tissue, they're going to be a lot thinner. They're going to have a lot less elasticity, and they're going to have those valves that will prevent the two-way flow of blood. Now, if we compare arteries and veins to capillaries, capillaries are going to be much, much smaller, right? We only find those in capillary beds. And the main goal for capillaries is not necessarily to transport blood like arteries and veins. The main goal for a capillary vein is to actually allow exchange or diffusion between the inside of the blood vessel and the outside, which is our body tissue. So to help with that function, the structure of the capillary bed is very thin. And in fact, the wall of the capillary bed is only 1 cell thick. And if you think about the way cells connect, they will slightly overlap with one another. And what this means is that if a substance needs to diffuse between them, there typically are little passages that would allow the diffusion of those substances to the body tissue. Okay, so we can see this is the basic structure of our capillary bed, a little bit more zoomed in. And I like this image because it shows that the body cells of the tissue that's going to surround this capillary bed are surrounding each of those little capillaries. And that's pretty necessary because the diffusion that's going to take place is typically between those body cells that require oxygen and the arteries of the capillary bed that are delivering the oxygen. So it's important that those capillary beds run through that tissue that's going to need those, resources. So I wanted to show you just really quickly this video, and I'm going to mute it here so we can just kind of see the images. The thing I like about this very short, oops, my mistake. The thing I like about this really short visual is that it actually shows you blood flowing through capillaries. Let's see if I can draw on the screen without messing this up. So we can see right here is going to be a capillary. And the way that I know that is that here is one red blood cell. And you can see that the capillary is about one red blood cell thick. I can see another capillary here, and I can actually see another tiny capillary here. And what that means is since the blood is running in this direction, there we go. Since the blood is running in this direction, that would mean that this would be a venule or a vein. Okay, so let me back that up real quick. All right, so this would be a vein taking those red blood cells away from that capillary bed. Now, if you notice in that video, the red blood cells that were coming in this direction were not moving quite as fast, and the red blood cells in this direction were not moving quite as fast. And that's a clear example of how we have control over how fast blood is going to move through those capillary beds. So without knowing for sure more about where this tissue is actually found, we could hypothesize that maybe some of that capillary shunting was occurring in this in that visual. Okay, so let's talk about the pressure that's exerted when the heart beats. So we've already gone over the contractions of the heart. We've talked about the electrical control with the SA node. We've talked about our atricular depolarization. We've talked about ventricular depolarization, where the atrium and the ventricles will contract. And we've talked about that systolic and diastolic heart sound, that lub-dub that we experience. What we're going to do is connect that idea to the idea of blood pressure. So as a refresher, we remember that systolic and our systolic beat is going to always refer to the contraction of the ventricles. So those ventricles are going to contract and squish blood out of the heart, pumping it to the rest of the body. So systolic, we remember, is going to be the heart contraction. So that's going to be our increase in pressure. Diastolic, remember, is going to be when those ventricles will relax and they will fill with blood from the atrium. And diastolic, a good way to think of that is that that's going to be when our blood pressure kind of relaxes. That's going to be the dub sound. All right, so this is our lub, this is our dub. Okay, great trick or memorization technique is that diastolic, when something dilates, it gets bigger. So you can remember that in diastolic, the actual size of the heart is going to get bigger as it expands and as blood is able to enter it. And in systolic, the heart is actually going to get smaller, at least the ventricles of the heart are going to get smaller because they are going to constrict and they're going to be pumping that blood through the vessels. Now, as that systolic heartbeat occurs, what's going to happen is more blood volume is going to be pushed through these arteries. And because the volume is going, or the actual space of the artery is going to stay the same and the volume increases, you can think about those gas laws or the pressure laws in physics and chemistry. When you try to fit more volume through the same amount of space, it's going to increase the pressure. So when that systolic heartbeat occurs, it's going to increase the pressure inside of our veins, inside of our arteries. So that leads us to one of the metrics that we use in the cardiovascular system. So blood pressure, I'm sure all of you guys at a doctor's visit have had your blood pressure taken, and they typically give you two numbers. Normal blood pressure is 120 over 80. Everybody is a little bit different. Some people's blood pressure run naturally a little bit lower or higher, but typically this is what we consider normal. The 120, or the numerator of that fraction, are going to refer to the systolic pressure. Essentially what that is measuring is that's measuring the amount of pressure measured in millimeters of mercury that would allow the blood to be pumped through the body. The 80 millimeters of mercury is going to be the pressure that is found in the arteries between the beats of the heart. So this would be when that heart is resting and refilling with blood. So that's going to be that 80 mmHg. When we look at our normal blood pressure range, we're looking at anything kind of between anything around 120 to 80. Anything lower than that is okay. Typically low blood pressure is not nearly as bad as high blood pressure. So high blood pressure we divide into two different categories. So we have pre-hypertension and then hypertension, which is high blood pressure. If you are a little bit higher, between 120 and 140, and between 80 and 90, that is going to put you in that pre-hypertensive demographic. If you have anything higher than 140 over 90, that does qualify as high blood pressure, and that's going to be when you start experiencing other problems with homeostasis within your body. Okay. Now, when we measure high blood pressure, technically blood pressure will drop off as you move from your arteries to your veins. We talked about this before, in that as soon as the blood leaves the heart, that's going to be at the highest blood pressure when we're in our aorta. And the reason for that is that it's closest to the heart and it hasn't gone through or hasn't traveled that far away from the heart. As we move from the aorta to the arteries to the arterioles, that blood pressure is going to drop down even further. And once we reach the capillaries, we're really approaching zero, especially when we get to the vein and back to the atrium. That's when we're really looking at pretty close to zero blood pressure. Okay, so with high blood pressure, one of the damages or one of the complications with that is that it puts a lot of stress on the heart. So the more blood pressure or the higher blood pressure you have, it's going to require those blood vessels to work even harder to keep that blood inside where it needs to be. If you have high blood pressure, it's also going to correlate to the buildup of those plaque formations we talked about. So high blood pressure can actually lead to atherosclerosis or heart disease. And if that occurs over time and we overwork those tissues of the vessels, it can cause an enlarged heart, meaning that left ventricle will continue to increase in size to try to compensate for the high amount of pressure inside of the body. And that unfortunately isn't a good thing. It's harder for our body to support and it can lead to heart failure. Okay, so one of the last things we're going to talk about is another metric. So we talked about blood pressure, and before that we talked about an EKG. Those are two metrics that we use. But one of the other metrics we use is this thing called cardiac output. And a really simple way to think about that is how much blood is pumped out of the heart every time it beats. So the way that we find out our cardiac output is that we take our heart rate. So that would be the amount of beats per minute, or beats per second, depending on what variable you're using. And you multiply that times the stroke volume. And the stroke volume is going to be that physical volume of blood that the left ventricle is going to pump out for each beat. So essentially you take that heart rate, you multiply it by the stroke volume, and that's going to be your cardiac output. Now, as you change your body, so as an athlete, you can increase your endurance by exercising and working your heart. And one of the ways you're able to do that is to affect your cardiac output. So as you run, your heart rate is going to increase. If your heart rate increases, your cardiac output is going to increase. What you can do, and what changes that you can see as an athlete, is that over time, you can actually increase the stroke volume of your heart. Meaning that if you are really fit and you have good endurance, your heart rate won't raise as high when you start to work out as somebody who has never exercised. So that's a healthy way to increase your cardiac output. Again, increasing a cardiac output is going to help you in sports and in performance, because the more oxygen you can supply those muscle tissues in your body, the better you're going to be able to perform. Okay, so that leads us to the end of our lecture here. These are simply just some review questions that you can go back through and test yourself. I would encourage you to pause the video here, go through these questions, and if you're not quite sure the answer, you can rewind. You can go back to that part of the tutorial and you can check your answers. The next screencast is going to cover different parts of the blood. I hope that was helpful.